Now, in the meantime, the CDC reports more than 3.4 million doses of the coronavirus vaccine were administered on Easter Sunday. This comes as more states start to expand eligibility.
Now, I know just in talking with people, there remain a lot of questions about the vaccine. So we're going to go in depth with Dr. Jeff POTHOF, who's good enough to join us again from UW Health. Doctor, good to see you again this morning. Let me start with this. I am hearing more and more from young people, like the 20-somethings, who are not in a hurry to get the vaccine. They are certainly in that group of people who have best weathered COVID infections. So what is your advice to this age group, maybe those in their late teens and these 20-somethings?
Yeah, I think this really goes back to those individuals in that age category thinking that COVID's not a big deal for them. So not so bad if they get it, and that's not just true. Statistically, they might do fine, but we've seen a lot of young people get pretty severe disease. The other reason is we really want them to play their part in helping us create herd immunity so that this disease isn't something that stays with us for the long term. So encourage all those young people, go ahead, find that vaccine, get a shot in your arm.
Dr. POTHOF, I know when the vaccines first came out back in December, the high efficacy rate in the 90s or so. Since that time, what have you learned new about the vaccines and their effectiveness? Have you learned more information to appease some of the fears that people might have about getting the vaccine?
Yeah, I think it's important for people to know now that there's hundreds of millions of people who are vaccinated. And what we've learned is that in real life, efficacy is still very high, 90% efficacy, near 100% efficacy against severe disease or disease that would hospitalize you. And that holds true, it seems, for the most part, against the variants that we know about right now. So just a phenomenal vaccine as far as safety and efficacy.
Doctor, for the teenagers, 16 to 18, they are only approved for the Pfizer vaccine right now. How quickly do you think the other vaccines might be available to that younger age group? I know Moderna is in trials for even as young as infants, but how soon till these other vaccines are more widely available to the youngers?
Yeah, I think you're still going to see fall or so. The first round of approvals, Pfizer had included 16 up, the others 18 up. But by this fall, I imagine we'll have data on some of those younger adults, even younger than 16, and they should be able to get their vaccine at that point.
All right, Dr. Jeff POTHOF with UW Health. Dr. POTHOF, thanks so much for your time this morning, as always.
Thank you.